let's get to the opening remarks right away, and we'll start this afternoon with the Acting Mayor of London, Josh Morgan.
Well, thanks, Dan, and good afternoon, everyone. It's a new week, and I think that's good reason for new optimism now in our year-and-a-half-long battle against the COVID-19 virus. For starters, students in London, Middlesex, and across Ontario are beginning their third week back to school, and despite much concern and plenty of unknowns headed into the school year, so far the early returns are extremely positive where case counts are concerned. For example, on the first day of school, September 7th, the 7-day rolling average for daily counts in London Middlesex was 22.3. As of today, that rolling average is virtually unchanged at 22.7. It's the same story across Ontario, where during that time, case counts have remained essentially flat or even slightly lower than they were compared to when classes resumed. Obviously, things can change, but as students enter their third week back to school, it is certainly a positive sign. Beyond that, I'm also encouraged by the ongoing progress in our vaccination efforts, both locally and provincially. Slowly but surely, more people in our region and across the province are doing the right thing by rolling up their sleeves and getting vaccinated, making the choice to protect not only themselves, but the vulnerable members of our community. So, with flat case counts now that classes are back in session, along with increased vaccination rates, those are two reasons to be optimistic right now. But there's also reasons to be increasingly hopeful in the not too distant future. We heard earlier today that significant progress is being made when it comes to securing vaccination approvals for children between the ages of 5 and 11. There's still no firm timeline as of yet, but it's reassuring to see clear progress on that front. This is a cohort that remains unvaccinated, not because they're unwilling, but because they're simply unable to, at least so far. Once that option is available, it will add another layer of protection for all segments of our society. Beyond that, as of this Wednesday, proof of vaccination will be required at all dine-in restaurants, nightclubs, gyms, sports facilities, and other venues across Ontario. Not only will this lead to greater consumer confidence, it will invariably make those venues safer while reducing the likelihood of transmission. There are other equally important upsides to this policy and how it's driven vaccination rates. The other day, I was going for a walk in my neighborhood. I was stopped by a gentleman who wanted to let me know that with all the discussions of vaccine passports and vaccine mandates in the news, that he had gotten his very first COVID-19 shot. And him and I had a great conversation, and he was very excited to now be vaccinated. I talked to him about his hesitancy. He said he really didn't know why. But with all of this news about the passports and the vaccinations, he thought now was the time to do it, and hopefully he is the first of many. It's a great story, and it was nice of him to stop me and talk to me about that. So that's part of the great news that I have to share today. And with that, I'll throw it over to Warden Burghardt-Jesson. Thanks.
Great. Well, thanks very much for that, Deputy Mayor Morgan. And as always, it's great to be with you on a warm September afternoon. Looks like this could be the last of our summer days that we're able to enjoy. So as Deputy Mayor Morgan said, this is a big week in Ontario, with proof of vaccinations now being a requirement for certain establishments and activities. And we certainly do not need to go very far on social media to read comments about the showing of proof and, of course, the upcoming digital passport. For many, this is an emotional subject. And as has been the theme throughout the whole pandemic, I implore everyone to be patient and to treat everyone with respect and kindness. Remember, those asking for proof of vaccination are doing so as a requirement that has been imposed upon them. Arguing and creating a scene with an employee from a local eatery or a security guard at a recreational facility will not change where we are today. We are in this together. So please do your part, think of community, and get your vaccine. It's funny that Josh would share a story about somebody in his community stopping him, because I have a similar story, only that's from a member actually of my own family who, for a number of reasons, has been very hesitant to get a vaccine. And I was pleased in speaking with this member who is a closer member of my family last week, when he called me to say, you know what, Mom, I did it and I got my first shot. So it's happening, and I see nobody else can see this, but Dr. Mackie raised his hand in fist in celebration, and it has been a weight off my shoulders in having that conversation with him. So it's never too late, and for whatever reason, if you're hesitant, if you've taken your time, please go to one of the pop-up clinics, go to a pharmacy. You'll be treated with respect, and we'll all be pumping our fists to say thank you. So since it's election day in Canada, and I tend to be a bit of a political junkie, I have to get my plug in to encourage those listening to today's briefing to get out to vote if you've not already done so. As Canadians, the ability to vote is not only a right, but it is a privilege. And I want to thank those that have put their name forward to represent a chosen party in hopes of representing community and country. Standing in front of an electorate is not an easy thing to do. But to take part in the democratic process is the envy of many across the world. So please do not miss out on this privilege. Dr. Mackie, over to you.
Thank you very much to the acting mayor and to the warden. As usual, really hammering on the important key points. So thank you very much. We are seeing, as the mayor pointed out, fairly flat rates over almost the past month, which is, really tremendous at this time of year, and not to see a significant increase in cases. The rate of deaths continues to be low, and these are all real positives. Our community is among those with the highest vaccination rates pretty much anywhere in the world, and tremendous credit to everyone involved in the vaccine campaign, as well as everyone who rolled up their sleeves. We do have pockets of vulnerability, and you're seeing that now. Children being diagnosed as schools open, not necessarily because of school, but because of the testing that happens when children are attending school if they have symptoms. I'll briefly mention the outbreak at the school that was announced on Friday. We had very low rates there. There are 4 cases of COVID diagnosed in that school, but only one of them seems to have been acquired at school. One, confidently, we can say was acquired elsewhere. Another was unrelated. We can't find any links within the school. So, while we technically do declare an outbreak there, there really isn't a lot of evidence of spread, and hopefully those numbers will stay low. The vaccination campaign, in terms of the rates, continues. You saw the announcement over the weekend that 85% of Ontarians have received their first dose. I imagine when we get our Saturday data on Tuesday morning from the ministry, we will see similar numbers here. We were very close to 85 as of last week. And the campaign through the mobile and pop-up clinics continues to be strong and continues to be a driver of our numbers. In the 6 days that we vaccinated at White Oaks Mall, we already hit about 1,200 doses administered there, and that campaign continues. We've extended that agreement with White Oaks Mall for an additional 2 weeks, so we'll be there, looks like, until October 3rd. And again, thanks to the mall for the partnership there, all the staff and everyone who's rolling their sleeves up down at White Oaks. It is a neighborhood that has had lower vaccination rates and higher COVID rates, so we're very happy to be in there and working with the community, and that going so well. With the move towards vaccine certificates being required this week, we have seen lots of people asking questions about how to best implement that, both in their workplaces or in the places that they frequent as patrons. And just again, so grateful to everyone who's taking this so seriously and thoughtfully. Lots and lots of great questions, lots of great suggestions and alternatives, people brainstorming, trying to get this right and trying to do things as safely as possible. So that continues to be an important piece of work for the health unit to do, to support those questions, and an important partnership with our whole community on that. Dan, I think I'll pause there, and we have Dr. Dukelow here to speak from LHSC today.
Thank you, Dan, Deputy Mayor Morgan, Warden Burghardt-Jesson, and Dr. Mackie. And thanks for having me here today to provide an update on the COVID-19 situation at London Health Sciences Centre. As of this morning, we're caring for 7 COVID-19 positive inpatients, with 5 or fewer of those in our ICUs. On the vaccine front, our medical affairs and occupational health and safety teams have been working tirelessly to reconcile our attestation rate with submitted proof of vaccination. While we're still in the process of validating our exact vaccination rate, I'm pleased to note that based on the flood of proof we received, it appears that the large majority of our people are on track to meet our October 22nd deadline for mandatory vaccination within the walls of LHSC. I also want to acknowledge Ontario's vaccine certificate or passport program coming into effect this week, and remind everyone that the passport is not required to access essential medical services at our hospitals. We remain open and available to provide care to all those who need it. That said, of course, we do continue to strongly encourage everyone who is eligible to receive their vaccination at their first opportunity, as well as to continue to follow public health guidance on hand washing, masking, and physical distancing. Lastly, as we look ahead to later this week, we are hopeful that everyone will safely enjoy the many official homecoming activities that are planned. We are asking our student community to please avoid taking unnecessary risks as you partake in the festivities. It remains important that as a community we do our best to help preserve hospital capacity, because that is what allows us to not only be prepared to respond to any sudden increase in COVID, but also to continue meeting the non-urgent and emergent healthcare needs of our community, including planned surgeries and procedures. Thank you again for having me, and I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Mackie, Warden Burghardt-Jesson, and Acting Mayor Morgan. All right, let's get to those questions. We've got a couple in the queue right now. And again, a reminder that if you are a member of the media joining us for today's virtual media briefing and you have a question you would like to ask, please submit it. Just click on the text bubble with the question mark in it here on Microsoft Teams, and as well who your question is for, and we will get that answered for you. Let's go to the first question for this afternoon. Dr. Mackie, this one is for you. It comes from Jane Sims at the London Free Press. Dr. Mackie, now that we're 2 weeks into the school year, are you seeing any warning signs that the schools might soon be swamped with cases from the 4th wave? Have they done better or worse than expected as far as the number of cases showing up in classrooms?
Yeah, it's a great question, Jane. We're a bit too early to say better or worse. You know, I look back at the school cases that we had in the 2020 to 21 school year, which ended, and, you know, we were at about 350 cases, bearing in mind that those cases would not have been associated with schools during the period the schools were closed. If you average those out, you know, it's pretty close to on par with where we're at. We might be seeing a bit more in terms of case counts than we had in those previous years, but it's pretty early to be able to say that with any confidence.
Thank you very much. Let's go to the next question. And again, a quick reminder, this actually right now is the last question in the queue. So if you are a member of the media and you've been waiting to ask your question, now would be the time to get it in for today's virtual media briefing. This question is for Dr. Mackie and for Acting Mayor Morgan. And Dr. Mackie, we'll start with your response on this one. Western University's homecoming is this coming weekend, and by extension, FOCO. Have there been any plans or beefed up enforcement of COVID-related bylaws? What advice do you give students for this weekend?
Appreciate the question very much, Jane. We are looking at what the options would be there. As you know, there is a multi-agency task force that works on this together and continues to work on that. You know, partners like the police and city bylaw have been working very hard, and we're looking at what options are the best to implement from the health unit's perspective. In terms of advice for students on the for this weekend, you know, we will be releasing shortly a red, yellow, green sort of postcard style infographic that helps people to see what the safe ways to party are. And there are safe ways, and we really encourage people to party safely. what the ways to party are where there is some risk, and the ways that we really identify as risky in the community. So that will be released likely later today.
Acting Mayor Morgan.
Yeah, thanks for the question, Jane. Really appreciate it. The first part was about plans for beefed up enforcement and COVID-related bylaws. As Dr. Mackie said, there's a multi-agency task force on this, and their work involves all aspects, including communication and education leading up to the event, the materials, like Dr. Mackie said, about if you are going to have fun and have a party, here are the safe ways to do so. But as you know, also enforcement and of course supports on the day of any event. So the answer is yes. There is active work on this file, and that continues each and every year, and of course is especially important during a year where there's the added risk of spread of a very crippling virus. What advice do I have for students this weekend? I think Dr. Dukelow said it very well. There are ways to take unnecessary risks, and there are ways to be very safe. And what we don't want students to do is take unnecessary risks. I think Dr. Mackie outlined the types of materials we're putting out. I think that is a good approach. Obviously, people want to celebrate on homecoming weekend. It is a weekend to come together and to celebrate. And there are very safe ways to do that. And there are very high risk ways to do that. And we want to, as much as possible, make sure that our students and all of our community members take common sense, reasonable actions when they get together and when they want to celebrate, and avoid the unnecessary risks. So I'm sure it should come as no surprise that a very large street party without masking or protections is a very high risk way to celebrate homecoming, and there are much better ways. So it's our hope that students will make the right decision to have a lot of fun this weekend, but do so in a way that minimizes their risk to themselves and our community.
Thank you very much, Acting Mayor Morgan. That does bring us to the end of the questions that we have for this afternoon's virtual media briefing. Dr. Dukelow, Dr. Mackie, Acting Mayor Morgan, Warden Burghardt-Jesson, thank you so much for your participation, your insights, your expertise, and for being part of this as you do on a regular basis. That will do it for us. We will be back with our next virtual media briefing, and that is coming up on the 23rd, Thursday, the 23rd of September, and that is at 2 p.m. We hope you will join us then. So between now and Thursday afternoon, have a great rest of your day. We'll see you, and so long for now.